Welcome. Let's talk about side sleeping or lateral positional therapy in obstructive sleep apnea. Now, you'll come across some of these scenarios when dealing with patients with sleep apnea. The first scenario basically is a patient who refuses CPAP, or they've tried CPAP and you've done all the troubleshooting to get them to use CPAP, will be more compliant with CPAP, but no matter what you try, the patient's given up and you're exhausted as well. The second scenario is a patient who's a little bit more health literate and they've kind of done their homework and they want to know other options prior to using CPAP, and using CPAP as the last option. The third one would be patients who are snorers, patients who came into your clinic or at your office and they've been evaluated for a sleep study. With a sleep study, and they found that all they are primary snorers, or all they do is snore, and they don't have any sleep-related breathing disorder, and they want to know how that can be reduced as well, because it depends, it really matters to them and their spouses. The next one is a patient where you would use lateral positional therapy in conjunction with CPAP or bilevel. Patients who have high pressure settings on their CPAP or even bilevel, and they can't tolerate the high pressure settings. In those situations, you may want to incorporate both lateral positional therapy and CPAP use. Alright, so let's get started. Now, how do you evaluate? The patient comes in and you want to see whether they transition from CPAP to lateral positional therapy. The first option is to look at the PSG, or the sleep study report, especially the CPAP titration. Now, when you look at the sleep study, if all you have is a pure sleep study, you want to look at the difference between supine sleep and lateral sleep. Look at the AHI and even look at the RDI. So you look at the AHI and the RDI. Now, if you want to consider lateral positional therapy in these patients, ideally you want the patients to have a high AHI or RDI when they're sleeping on their backs, and you want to have a low AHI or RDI when they're sleeping on their sides, ideally less than 5. But in a lot of patients as well, a 50% reduction or the difference between lateral position and supine position may be adequate enough for them to get started on lateral positional therapy. Now, again, you don't want to be a purist about this. If the patient truly has refused or is unable to use CPAP, it's better to use something that's suboptimal than not to use something optimal completely. The next thing is to look at how to implement lateral positional therapy. So there are low-cost ways of doing it. One is the tennis ball approach, where the tennis ball is sewn into a little cloth pouch, and it's sewn into the back of the t-shirts, preferably the level of their neck. However, this ball tends to shift from side to side, so it may come undone and really not serve its purpose. But this is a reasonable low-cost approach. So if you're looking at it from the back, then, excuse my drawing, and that's why I didn't go to art school, is that you'll see that there is a pouch right here. This is the neck. However, this may shift from side to side, as most t-shirts are also kind of, they're not tightly fit when you go to sleep. The next option is the body pillow approach. So if you have someone lying on the bed, assuming this is what it looks like when they're laying on their sides, they can use a bolster that they hold on to, wrap their legs around, but you can also apply a bolster on both ends. Again, the bolster can move from back side to side, so that may not be effective as the night progresses as well. The other option is the lateral positional therapy vest. Now, there's a company out there, and I'm not sure whether there's any others right now, I'm sure there are, that produces a lateral positional therapy vest. So the patient will go to sleep at night, they'll put on a vest that has a sort of cushioned back portion over here that makes it uncomfortable for them to get on their sides. Now, some of these devices, if I'm not mistaken, they're trying to incorporate a sort of compliance report as well to see how compliant the patient is. And that's a great segue into what I'm going to say next. Most patients will swear to you they never lay on their backs, but most patients are not aware when they're asleep as well. So I take that with a pinch of salt. The other option as well is what it's referred to in tongue-in-cheek as the elbow index. It's the number of times your spouse will elbow you to get you to lay on your sides instead of your back, because your snoring is disrupting them. So the next thing to do is to retest patients. Now, just because it works for some, lateral positional therapy may not work for all. The other key point is that what works now may not work in the future. As the patient gets older, they may gain weight, they change medications, for example, or if just because of aging as well, then laying on the sides don't work as much. So you may want to retest these patients down the road. So just because it may work now on some patients doesn't mean it works for every patient, and again, it may not work for very long. So these patients should come back to the office for evaluation to see whether some of the symptoms have recurred. Okay, thank you.